On my channel, I try to explore all kinds of different ways to do body sculpting and body contouring. I have done a lot of cool sculpting. I've done ultrasonic cavitation and radiofrequency skin tightening. And so today I'm going to hit on ESWT, or extracorporeal shockwave therapy, specifically the ShockWave Pro from MTS Aesthetics. I have just learned about ESWT, and I really didn't even know what it was until just recently. And so when MTS sent me the machine, I was really excited to try it, but a little bit apprehensive because I really didn't know what to expect. ESWT, extracorporeal shockwave therapy, is used to treat soft tissue, specifically plantar fasciitis, tendonitis, joints, the soft tissue in your joints. For example, I have rheumatoid arthritis, so it works for that. Carpal tunnel, erectile dysfunction, PD, and cellulite. I'm so excited that it treats cellulite. My channel is all about body sculpting and body contouring, so if I can show you guys and present to you guys something else that works, that treats cellulite, that really excites me. I'm also really excited that it helps with joint pain. I have a lot of pain. I have rheumatoid arthritis, so I deal with chronic pain. And this machine is proven, it is scientifically proven, shockwave therapy is scientifically proven to help treat with joint pain. So I'm going to go through this machine with you. I'm going to show you all the different functions. I'm actually going to do a demo on my wrist. I'm going to do a demo for cellulite on my thigh, and I'm going to do a demo for ED. So please know that it's not my intent to offend or embarrass anyone. I'm just going to go through and do the demo the best I can. I'm not a doctor or have any medical or aesthetic experience. I'm just someone who has a lot of issues, and I figure it out. I do a lot of research, and I just try different things and see what works. So this is strictly a demo. There's not going to be a before and after because I just got this machine. MTS Aesthetics sent it to me when I reached out to them for their cool sculpting machine. So that's going to be another video. The cool sculpting machine is going to be a completely other video. So this is just the ShockWave Pro demo. But before I do, I'm Joan Johnson, and this is Beauty Over 50 on a Budget, where I do body sculpting, body contouring, and sprinkle in a little bit of anti-aging and skincare. If this has sparked your interest, please consider subscribing to my channel. I post new videos every week. Okay, what is shockwave therapy? Shockwave therapy is shock waves emitted through the handle of a machine into the joint or the soft tissue. It creates micro injuries, and by creating micro injuries, it signals the body to send more blood flow to that area. So when you have a chronic injury, a lot of times your body will create scar tissue over that injury. It's encapsulated in scar tissue. Your body can't get to it. Your body can't heal it because the scar tissue is encapsulated that injury. So for chronic injuries, it's good to bust through that scar tissue so that it can create micro injuries so that the body can start to heal. The blood flow can get to the area and start to heal that area. Again, I'm not a doctor or have any medical aesthetic experience. I just have done a lot of research on this machine. How it works with cellulite is same thing. It creates micro injuries in the area that you're targeting. So for cellulite, it's condensed fat cells that are packed together and they're protruding through the fascia, creating the bumpily effect. So what this machine does is it breaks through that and creates micro injuries into the dermis and the fascia, and that way it sends more blood flow to that area, in turn creating collagen and causing those fat cells to bust up. So that's what smooths and tightens the skin, is that new collagen that these micro injuries are causing your body to create. So that's how it does the cellulite. Then as far as the ED, it works by creating micro injuries in the top of the penis, and that creates new blood flow to the penis. So again, it's not meant to offend anyone. Please, if this is offensive to you, please just fast forward through that part, because it's not my intent to offend anyone. I just want to show you what this machine can do, and I'm so excited about it because, like I said, I suffer from rheumatoid arthritis and cellulite. So I just want to share it with you guys and share all that I know with you. Okay, when you get your machine, this is what it's going to look like. It's going to come with a really nice box. This is a really nice heavy-duty box. And then all of the attachments come here. So this is the different heads. The cord, the power cord. And like I said, I've used this before, so it's not packaged as tightly as it would when it ships. And this is the handle. This is the stand. And then there's some extra rubber caulks that go on the handles, the heads, for the different treatments. Then this is a model of a penis. So when I do that part of the treatment, the demo, you can fast forward through it so that if you're sensitive or it's not my intent to offend anyone. So if you're sensitive to that, please just fast forward through it. Then the actual machine has a dust bag that it comes in. And this is all padded, so it's really nice. You can see the inside of this box. It's a really nice box. And then here's the machine itself. And the box is a little bit heavy with everything in it, but the machine itself is not heavy. But when it's in the box and with all of the attachments, it is a little bit heavy, so fair warning on that. Okay, so now I'm going to show you how to hook it up. This is where the power cord goes. And then this is the power button. On the side here, this is where you hook up the handle. And this is really neat because this plug-in has a red dot on the top. Right there. Get this to focus. That red dot. And then there's a red dot here. So you know exactly where to plug it in. Just like that. Okay, so now I'm just going to power it on here. The default code to this machine is all 8s. Okay. then it automatically goes to the wrists. And see how it highlights in light blue what body part that you're working on. Here it shows what heads to use. All of these heads have a number on them here. So for the wrist, you would use 1 or 2. So here's 1. And this is what it looks like. Here's the handle. And this just screws into the head right there. And then it's ready to use. So to do your wrist, it's already preset. It's on mode C. It's already set at the energy and the hertz, the frequency. And then you hit start and it automatically counts the impacts, and it will shut off when it's at the designated time. So get it to focus in. See how it counts the pulse each time that it does it. So whenever you're doing your wrist, this is the handle, or this is the holder that holds the handle in place. So you can either set it this way or you can set it this way, whichever you prefer. So whenever you're using one of these machines, you need to use ultrasound gel. I'm going to take my watch off so that I can show you. This is the ultrasound gel that I like to use. I buy it by the 5 liter because I use it for my ultrasonic cavitation and radiofrequency skin tightening. I also transfer it into a smaller bottle, and that's what I like to do. So I'm going to demonstrate how to do the wrist right now. Just put a little bit of ultrasound gel on my wrist. I'm going to do my thumb too because I have a lot of problems with my joints and my thumb. So it's already preset to wrist, and it's highlighted right here in blue. It's got the preloaded pulse, how many times it's going to impact, and then it's going to count it for me. It's got mode C and mode P. So I'm just going to leave it on the preload mode C. Start. And then all of that is here as well. That you can turn it up the frequency or turn it down here and here. And then your start and pause. It doesn't hurt. It feels really good actually. This is really good for carpal tunnel or like what I have, rheumatoid arthritis. Any kind of joint pain that's soft tissue related. I worked in the grocery industry for years and years, so I have tendonitis in my wrists as well as rheumatoid arthritis. So this is really good for tendonitis. It is uncomfortable if you go over a bone. So if you go over like this part, that would be a little bit uncomfortable. I'm just kind of moving it around here and back to my wrist. So right here, it's keeping count of every time that it's impacting. So I'm at 450 and it's going to go for 1,000. This is what's sending the ShockWave through your soft tissue with the help of ultrasound gel being the conductive medium. Use number 1 tip or number 2 tip. So this is number 1 and this is number 2. So now I'm going to put on number 2 and see how that one feels on my wrist. And then, so I hit pause, now I'm going to hit start again. So this is number 2. And I'll be honest, I believe number 2 feels more comfortable on my thumb and my wrist. Because it's bigger. It's got a bigger tip on it. It's a lot more comfortable. So I think on my next treatment when I do this, I'll use 2. Because there again, it tells you exactly which ones to use. That tells you it's done. Your session is done. That's how simple this machine is to use. It goes through everything for you and lets you know when you're done. So to clear that screen, you just hit any spot on the machine. So then we'll just go right down the line. So then it goes to the elbow and it highlights that area. It's preset for 2,000 impacts. 3 hertz is the frequency. The energy is 20 mJ and the mode is C. So it's all preset. It has the tips are suggested are 2 and 3, and we used 1 and 2 on the wrist, so 2 is already loaded for the elbow. And like I said, they're all numbered. So here's 3. I haven't even opened it yet. So it comes really tightly wrapped. And this tip is a little bit different. It's more flat. It's more of a flat tip than the rounded tip 2. So there again, just unscrew it. So easy to operate. So my thumb is a little bit tender, but it's not bad. So it's set for the elbow and then start. And this is all preset too, and then just hit start. This is the pubic synthesis. And this is saying 1 and 2 would be the tips. The knee would be 3 and 4. So this is 3. And this is what tips 4 looks like. It's a bigger end on it, and it's flat and concaved instead of having a dome on the top. Foot and ankle. This is really good for plantar fasciitis, tendonitis, or any kind of foot and ankle issue. And there again, tips 1 and 2. Shoulder, tips 4 and 5. And 5 came with a sleeve already on it. And then you get extra sleeves when you get your machine. The lumbar region, which is the lower back, you never want to use this on the upper back or over the heart. Only the lower back and the shoulders, the external parts, never over the heart. The hip, I use this when I do my treatments because I have a lot of problems with my hips. And it has the tips 4 and 5, and it has the preset of 2,500 impacts with a frequency of 8 hertz, the energy of 100 mm, and mode C. Fat accumulation, this is the one that you would use for cellulite. So anytime you're doing cellulite, then you would use tip number 5 for the cellulite. And it's 2,500 impacts, frequency of 10 hertz, and an energy of 100 mJ. So I'll do the cellulite on my thigh. Demonstrate the cellulite. So you have to use ultrasound gel. So it's preset at 2,500 impacts, 10 hertz with 100 mJ. So it automatically stopped when the treatment was over, when it reached the 2,500 impact. The ED, erectile dysfunction, you would use tip 5, 6, and 7. It has an impact of 300, 3 hertz, and 5 mJ, mode C. Okay, so now I'm going to do the ED. So I just pressed ED button and it highlighted the area. It's going to be doing 300 pulses, tips that we're going to be using. We're going to start out with a 5. Now, I'm not a man, so I have just a model of a penis. So please, if this is offensive, please just fast forward. I'm trying to be as respectful as I possibly can. It's not my intent to offend or cause anybody any discomfort. I'm just showing you what this machine can do. So the directions say to start out with a 5, the tip 5, and use it on the prostate. So that's what we're gonna do. So there again, it's already highlighted. So we hit start. And then here. And I can feel it barely pulsing through the model. And I can see that the counter is going, but I can't hear it. But I can feel it. So that goes for 300 impact, an impact of 300. Okay, so it just told us to stop. So that's the prostate part of the ED treatment. So now I'm going to change the tip. So here are 6 and 7. So the directions stay to do a total of 1,500 impacts, 300 per section. And do more more impacts toward the tip, less up here, and then slowly work towards more towards the end. So we have a number 6 on here. I'm going to hit start, and it's at 300 impact, 3 hertz, and a 5 MJ. How often do you use this machine for ED? It is in the protocol that MTS Aesthetics has set out. They recommend that you do it twice a week for 3 weeks. Then wait 3 weeks and then start the protocol again. So 3 weeks on, 3 weeks off until you've reached your desired outcome. The protocol that MTS Aesthetics is suggesting for joint pain, plantar fasciitis, and soft tissue is just 3 to 4 treatments needed at a weekly interval. So what my husband and I have decided to do, because he's having shoulder pain, is we're doing a treatment, we're waiting 5 days and doing another treatment. And that seems to be working for him. And we'll do that 3 to 4 times, and then we'll wait a few weeks and then repeat the protocol if needed. Same with cellulite. You don't want to do this too often because you're creating micro injuries under the skin. So for me, I'm personally going to do it once a week for the next few weeks to see how it goes, and then I'll give you guys an update. I'm only doing my right side, so I've done my arm and I've done my leg. I won't do the left side so that we can compare the difference. I really hope this video gives you guys some insight on some other treatments that you can do for aesthetics and for pain. If you're really sensitive to cavitation because the ringing in your ears, you might have tendonitis, or you're just really sensitive to the loud high-pitched squeal that the cavitation does. This does not do that. So this is just another option that you can use for your cellulite. If you enjoyed this video, please let me know. Like and subscribe and leave a comment down below.